Hey everybody, Dr. Cody Senkyr here from Chiropractic, and I just wanted to shoot a quick video because a couple weeks ago, or maybe even last week on Facebook, I posted something talking about how infants and even kids should get adjusted even though they may not have symptoms, and took a lot of heat. A lot of people saying, why in the world would you adjust kids? They don't have neck pain or back pain. Well, I came across this research article, so bear with me for 1 second because I will be reading a little bit and got to take this full circle because this article is from 2015 and it's from the American Journal of Neuroradiology, and it's titled MRI findings of disc degeneration are more prevalent in adults with low back pain than in asymptomatic controls. Seems pretty self-explanatory that people with low back pain have a higher prevalence of disc degeneration than people without it. But watch this. So they studied 3,097 subjects, all under the age of 50. And they found a bunch of things, but also disc degeneration was found at a very high prevalence in the asymptomatic individuals, ranging from 30% to 95% depending on the age group. Asymptomatic meaning they do not have a symptom and there's already degeneration forming. And 30% of subjects had disc degeneration with no symptoms, increasing up to 95% of age populations. And, sorry to be redundant, but this is just saying that people, ranging anywhere under 50, they had different age brackets. You can have 30% of the population, probably between 15 and 20, having disc degeneration, and then probably 45 to 49 having 95% disc degeneration without having a symptom. So I get that a lot in the office. Doc, why are you taking an x-ray of my neck and my low back hurts? Because I want to make sure that there aren't any issues before we start getting you adjusted. And, I've seen kids as young as 15, 16, 17 years old already having degeneration in their neck. Why? A lot of people ask. Well, think about this. Even as recently, now there's a diagnosis code called text neck, because you walk around a mall, every single kid is looking down at their phone. Their backpacks are too heavy going to school. They're sitting down, looking down all day in school. They get home, they're doing homework, but then they're on their phone playing games, texting, everything's looking down. That causes degeneration in the neck. But also, the reason why I sent out the Facebook post in the first place is because birth trauma. Birth trauma is amazing. What it can do to a baby's spine. Because let's say a normal vaginal birth, the doctor, what's the first thing the doctor grabs? The head. And then they twist to line up the shoulders and pull. That's 70 pounds of pressure on the baby's neck. If they use forceps, it's 90 pounds of pressure. And if they use a vacuum extraction, that's 120 pounds of pressure on the baby's neck. And these muscles have never even developed yet. Then, between the ages of 2 and 5, experts are suggesting that kids fall about 200 times. Now, whenever I say that to patients, almost all of them say it's probably more. They're falling. We have issues with their neck from their first seconds of life. They don't have neck pain. They don't have low back pain. They don't have headaches. But we want to they don't have symptoms, which they just can't communicate them. But that's why we want to get them adjusted. That's why these babies need to get adjusted, to make sure that they're set up for the best potential possible. And, just reading all this, this is a significant finding validating the need for virtually every single human, man, woman, old, young, infant, to get adjusted or at least get checked by a chiropractor to see how the nervous system is functioning with their body or inside of their body. The nervous system is the master controller with the body. The spine surrounds and protects the central nervous system. It's actually the only thing that does. And if it's the only thing that surrounds it for protection, it's also the only thing that can hurt it if it's out of position. So that's why kids need to get checked by a chiropractor. Getting adjusted by a child is adjusting a child is very different from adjusting an adult. very light, very gentle, because we're not dealing with degeneration. We're not dealing with unhealthy spinal habits. The younger they are, the quicker and the easier and the lighter the adjustment can be. But, it's important to note that chiropractic, we don't treat anything, but we take the pressure off the nerves, get the body healing the way that it's supposed to, and amazing things can happen. Sinus issues, allergies, asthma, autism, ADHD, growing pain, immune system problems are just a few examples of things that chiropractors all across the world have gotten testimonials from patients from being able to help. But the reason is a subluxation is when a bone or there's an interference with the nervous system from being able to work through some kind of trauma, toxin, or thought. So removing a subluxation, getting the body back able to heal, is the best thing you can do for yourself or for your kids. So if you want to set up your kids to have the best potential possible, they need to see a chiropractor that is subluxation based to get their body back healing and functioning the way that it's supposed to. So if you or your family member or any of your loved ones are dealing with a health issue, we first have to look to the source, which is the nervous system, to get that back working. So once again, went full circle how a study talking about back pain and degeneration in adults to why we adjust kids and why everybody needs to be at least checked by a subluxation-based chiropractor. Give me a call at 248-625-7600. Check out my Facebook, drcodysenkyr.com. Putting out a lot on research. We have a lot of exciting things coming up on what we're going to be doing with nutrition, detox, being able to help people with thyroid issues, autoimmune digestive issues, all these different things. It's so exciting because we get the body back able to heal, do what it's designed and supposed to do, which is heal. So thank you guys so much for bearing with me, listening to me. God bless you. Give me a call if you have any questions. I'd love to talk to you. Have a blessed day.